So, the risks of labiaplasty are probably over resection, and then leaving people with scar tissue in places that might be uncomfortable, like the posterior aspect. Um, I think scar tissue and tethering and the complications I've seen either presented or in papers have been related to over resection. So it's real important. I always tell patients I can always take a tiny little bit more, which I don't often have to do, but it's better to have a little bit more labia than have like a weird scar or pain afterwards. The other complications are bleeding or infection, and those are very rare. You can have a bleeding complication like a hematoma. Again, it's usually about taking it easy for those first 3 days. And then if it's an immediate bleeding problem, then I would bring you back to the operating room and explore and reclose. I've had to do that once, knock on wood. So it's not very common. And then wound healing complications, also very rare. So um, it is more prevalent in smokers. So I do make sure that you're not smoking for 2 weeks before and for 2 weeks after. And we do a nicotine test on the day of surgery, and I'll cancel you if you're positive for that, because the one time I had like a real wound healing issue was in somebody that was smoking and I didn't recognize that. So it's funny, again, I'm in Southern California, so marijuana is legal. Um, I don't really care about the marijuana. It doesn't have wound healing problems. I prefer if people are having general anesthetic that you're not smoking marijuana and you switch to edibles. But if you're, you know, doing marijuana and having a labiaplasty, it's not really my problem. But I will say any kind of smoking, nicotine gum, vaping, regular good old cigarettes, all of that's any kind of nicotine is impairs wound healing, and so we make sure that that's not on board. And then, making sure that you're careful after surgery is important. I cannot stress enough how important it is to give yourself time to recover. That definitely decreases your risk of having complications. So people do it all the time, like, are, you know, pushing the limits, but I really think you're taking a risk that you don't want to have to take.